So, George, thank you for joining me on the video interview. I'm really excited to get your perspective on the pandemic and digital health in particular, as you reflect back on a lifetime spent in healthcare. First, would you mind introducing yourself, the role that you had, and some of the conditions that you spent your time focusing in on?
Oh, yes, of course. First of all, thank you very much for inviting me for this interview. In fact, I've been a cardiologist since almost 35 years. And since the beginning of this year, I am retired. Before becoming cardiologist in 1987 in the Netherlands, I did my residency in internal medicine for 3 years in an academic hospital in Romania. And subsequently, I went to Mexico to do 3 years of cardiology at the National Heart Institute, Ignacio Chavez. I finished my residency at the Thorax Center in Rotterdam. And the last 20 years, I was working in the University Medical Center Radboudumc in Nijmegen as head of the clinical ward of cardiology. Besides this, I obtained a degree in philosophy in 1976 and got a PhD degree in 1992. That's my career in a short cut.
That's excellent. Yeah, I didn't know about the philosophy as well. That's awesome. That's something I'd like to have a crack at as well. So thank you. Okay, so what was it about the role that you were most passionate about?
Well, my passion in cardiology was the contact with the patients on the clinical ward as well as in the outpatient clinic. It was always very motivating and thankful to help patients to get better or to support them as much as possible if therapeutic options were limited. And scientific research was also my passion.
What do you think the key health learnings should be from the pandemic?
Key learnings from the COVID-19 pandemic are that it demonstrates that once more that the human organism is not a sum of independent organs, but that the human organism is a whole in which organs are interconnected as well as with the mind. Therefore, we see not only pulmonary problems, but also cardiac, hematological, and cerebral problems. Optimal therapy can be achieved only by an integrated approach in which infectiologists, pulmonologists, cardiologists, and internal medicine cooperate. And last but not least, as far as the human mind is also concerned, we should never forget that together with this medical approach, the social and emotional impact of a COVID-19 infection should not be forgotten, especially because isolation is one of the cornerstones of therapy. It was heartbreaking how critically ill patients in several occasions passed away without having close contact with their dearest loved ones during their last hours. Every patient is unique and deserves optimal assistance from a medical as well as from a psychosocial view. The pandemic also teaches us that we should take care of the world in which we are living, and we should have more respect for all other living creatures on Earth, and not only reducing them as food supply for us.
Wow, there's a lot of points in there that I could not more wholeheartedly agree with. But yeah, thank you, thank you for that. So, what role do you think that digital should play in a kind of a post-COVID world? What do you think?
Well, the digital advances have given us the opportunity during the COVID crisis to diminish the social and psychological effects of the lockdown in the different countries. Although we could not often touch each other physically, the digital advances gave us the opportunity to stay in touch by voice and by image. We also learned from the COVID problems that long distance traveling by air for commercial and scientific purposes can often be replaced by video communication. The positive side effect is less family disruption and less air pollution. And also in the medical world, we discovered that a lot of medical controls in the outpatient clinic can be replaced by remote video contact. Patients do not have to quit their jobs during several hours because of travel time or waiting time in the outpatient clinic. And furthermore, elderly and more handicapped people did not have to make an effort to travel and to disturb a relative or a neighbor to bring them to the hospital. Mm. Also, the video contact is at least partially capable to show the conditions in which someone lives and what kind of adaptations may be needed in their houses because of their disease. And another advantage is that even from another distant place, a close relative can join as a third person the video contact and give extra information about the condition of the patient. So the challenge for us in this post-COVID world will be to evaluate which contacts still need to be performed in close physical contact and which contacts can be adequately replaced by the digital way. We should never forget that close physical contact is the essence of our human communication, and the digital communication should always be seen as a replacement, which can, however, be more or less optimal depending on the situation and the individuals which take part in the communication. For instance, a very bad example of misusing digital communication, which has been described in the news some time ago, is that a robot, instead of an empathic physician, should communicate a bad news interview with a patient.
I didn't see that particular report, but your message resonates. I mean, we are ultimately the social apes, and the physical contact is, you know, absolutely paramount to a healthy individuals for sure. So I agree. Are there any, but on that, the counter to that, are there any digital interventions or technological developments that you think or believe hold particular promise?
Well, I think in order to optimize digital communication in the medical world, I think that the simultaneous digital registration of vital signs, such as heart rhythm and heart frequency, temperature and blood pressure, could improve the medical value of a remote video contact with a patient. So these registrations are already available online, but are not yet routinely integrated in a medical video communication. Also, it could be thinkable that the physician would be sometimes virtually present at the patient's house, like as a hologram. This may be suitable for elderly people to have the feeling that their doctor is really present.
Yeah. No, I like that. That's I mean, that might be a little way off. Do you see that in the near future? The hologram?
Could be, yeah, it could be.
Yeah. Do you, out of interest, do you own an Apple Watch or a Fitbit or similar?
Yes, an Apple Watch. Yeah, Apple Watch.
You do? Okay. Yeah. Interesting. Interesting. And do you like it?
I like it, but I'm not really permanently connected with it.
Okay, fair enough. But I bet you know your I bet you know your step count from last week, though, don't you?
Yes, exactly.
Yeah. Okay. Cool. So, what do you think the key challenges are that will need to be overcome for better cardiovascular health in the future?
Well, the challenges to realize better cardiovascular health should not only be sought in sophisticated technological advances, in my view. Most important is primary and secondary prevention. Better attention for healthy food, for example, more physical exercise, less stress, and no smoking nor other addictions. By giving more emphasis to prevention, we will realize that we need to take more care of the nature around us, and we should not always be in a hurry for more money or promotion in our daily work. The COVID pandemic has forced us already to reevaluate the relation between work and family because many people needed to work from home.
You agree? Fundamentally, yes, I do agree. I think it's a fascinating space right now. I don't know quite where we're going to land, but I think a bit like healthcare. I think there's a role for digital and physical, and I think there's Um, you know, it's about creating that kind of a symbiotic relationship for both of them in the future, for for better outcomes, both kind of as a
we have to find the right balance.
Sorry, go on.
We have to find the right balance between the digital communication and the physical communication, indeed.
Yeah, I agree. Switching a little bit, just to kind of thinking about the health ecosystem, so other players. How do you think of pharma and medical device companies? Do you think that their role should evolve in healthcare?
Well, I think the pharmaceutical and medical companies should communicate much more by video communication. Representatives should not come and visit the physicians to the hospital in the hospitals, but should be scheduled for a video contact. And then during congresses and teaching courses, the representatives would then still be able to get in physical contact with the medical personnel. That's what I think is more efficient for the doctors as well as the companies.
So it's a role that shifts towards more education, more information.
Yes. Yeah. In a digital way, yeah.
In a digital way, yeah. Okay. Interesting. So, last question. And as you reflect back on a career in medicine, what is your hope for healthcare of the future?
Difficult question, but I'll try to answer it. Reflecting back on my career, I would be very happy if the medical world should be more and more aware that they are part of a much larger social and psychological world. If more attention will be drawn to prevention, physicians and patients will become more aware of their responsibility to take care of the world around us. Mother Nature should be respected and not be abused. Healthcare should become part of care for nature. Not only in my career, but also during the recent COVID crisis, I've learned to appreciate the importance of close contact between each other. And most important things in life are often without any price. The thankfulness of patients who got better, the happiness of their closest relatives, the strength of the patient who could still smile despite a very serious disease, the genuine love and tenderness exposed by the family during their farewell of the dying patient. Typically, these things cannot be expressed in digits, but they form the essence, in my opinion, and the beauty of life.
Wow, that's a lovely sentiment to end on.
That's the philosophical point of view also.
Yeah, but it's very interesting, and I think that we're in an interesting kind of point in human evolution, where some of those values perhaps need to be given greater emphasis as we move forward. Yeah, I agree. Well, with that said, I'd like to thank you, very much indeed, Gheorghe, for agreeing to be interviewed and kind of getting to the point of actually joining me on the call. Hopefully, we've recorded it okay. Fingers crossed. And honestly, I think some of your points about the way you're talking about healthcare as being, fundamental to the health of the world. That nature is integral to this, and if that's not healthy, then there is no health ultimately. I think it resonates very strongly with me. I spent a lot of time thinking about that. So, but I'm hoping this is not our last conversation, and we can kind of we can bat a few ideas around. That would be amazing.
It was very, very nice to be in the interview and that you listen to my story.
Yeah, no, absolutely. And I know that you have there's nothing to compel you to do this. So thank you once again for taking the time. I really do appreciate it.